Hello everyone, welcome to the video on GPAT 2022 Key Explanation Series. In this video, I will explain about pharmacology questions with answer explanation, and this is part 3. I have already made 2 parts of pharmacology. This is my YouTube video. If you like the content, do subscribe and share. Let's get into the topic. Now, the questions: which of the following is a specific enzyme marker of cell death in acute myocardial infarction? See, enzyme markers means a particular enzyme levels will be elevated or increased, and that indicates a specific condition in the body. Now, creatinine kinase indicates the damage to skeletal muscle as well as cardiac muscle. But this will not a perfect marker for cell death of myocardial infarction. So this is not the option. Now the next one, aspartate aminotransferase indicates liver damage. When there is hepatitis or liver cirrhosis, this particular enzyme levels are increased. So this is not the answer. Next one, lactate dehydrogenase indicates tissue damage. So when there is a tissue damage, lactate dehydrogenase enzyme levels will be increased. So again, this is not the answer. What is left with? Cardiac troponin. Now the levels of cardiac troponin indicates acute damage to heart or myocardial infarction. So this is the answer. So the increased levels of cardiac troponin indicates cell death in myocardial infarction. Moving to the next one. Now, which of the statement is true with geriatric practice? Geriatric means old age. So when medicines are given to old age people, the particular practice has to be followed. That is called geriatric practice. Let us understand them. See, the incidence of adverse drug reaction diminishes with advanced age. Diminishes means reduces. No, this is not the case. When age is advanced, during old age, the adverse drug reactions increases. Now, dose reduction is inevitable for each and every drug used in geriatric patients. This is not true. Dose reduction is not compulsory for each and every case. In case of antacids, they need higher amounts of dose. So it is not true. Now, patient compliance is highest in geriatric patients. No, patient compliance will be very low. Now the last one, polypharmacy is often a problem in elderly people. Right, when people take at least 5 drugs, it is called as polypharmacy. When there are multiple drugs are administered, there is a chance of multiple drug interaction, and especially it becomes a major problem in elderly people. So which of the following statement is true? This statement is true. Moving to the next one. Now, which of the following type is a reversible cell injury? Understand these terms. Excuse me. Karyolysis means, karyo means nucleus. Prokaryote, eukaryote. That karyon indicates nucleus. Karyolysis means nucleus damage. This is irreversible. It will not be reversed. Now, nuclear clumping is a process in which chromatin will get condensed, and during adverse situations chromatin may get condensed, and this is reversible. So this is what is the question about. Now, the next one, phagocytosis. Phagocytosis is where bacterial cells will be eaten by immune cells, and the bacterial cell death will occur, and this is also irreversible. Cytoskeletal damage. See, cytoskeletal damage, when it is severe, it breaks the plasma membrane and it results in irreversible cell damage. So among all of them, what is reversible? It is only nuclear clumping. Moving to the next one. Now, reason for the combination of diphenoxylate and atropine. See, this combination is used to treat severe diarrhea. When there is an uncontrollable diarrhea, this is used. But the important things are, diphenoxylate is a narcotic analog. Because it is narcotic analog, when high amount of dose is taken, it will cause CNS excitation. So there are chances that to get CNS excitation, people may increase this dose to get that CNS excitation. To avoid that, atropine is included here. When dose is increased, atropine dose is also increased, and that causes adverse effects. That will discourage people to abuse this drug. So what is the answer here? Discourage abuse of diphenoxylate. The combination is to discourage the abuse of diphenoxylate. So this is the answer. Moving to the next one. Now, regarding bromocriptin, which of the following statement is true? See, what is bromocriptin? It is given here. It is relatively selective dopamine D2 agonist with prominent action. So it is a D2 agonist. So what all the effects are there? See, which of the following statement is true? Now, look at the options. On pituitary lactotropes, it inhibits prolactin release. Yes, bromocriptin in fact is used to inhibit prolactin release So this is the true one. In striatum, it accepts anti-Parkinsonism. Levodopa converts to dopamine, and that is what treats Parkinson's problem. Now, in CTZ antiemetic, no, it causes emesis, not antiemetic. Dopamine antagonists are used to antiemetic effect, but dopamine agonists will cause emesis. This is not true. Now, as an adjunct treatment for type 2 diabetes mellitus, true. When bromocriptin is given, it regulates the levels of blood glucose, and that is what used to treat diabetes mellitus. So A, B, D are true, and look at the options. Only A, B, and D only true. So this is the answer. So don't get confused. So observe these questions carefully. Dopamine agonist causes emesis. Dopamine antagonist will cause antiemetic effect. Moving to the next one. Now, the objective of abbreviated new drug application. See, this is called as ANDA, abbreviated new drug application. See, NDA, new drug application, is to get market approval for new chemical entities, whereas ANDA is to get market approval for generic drugs. A straight away question. So the option, this one is correct. Moving to the next one. Now, at the site of tissue injury, the activated platelet releases ADP and activates surrounding platelets to form platelet plaque. But this process will not continue to activate whole platelets in the body to form massive ball of platelets because, understand this one, see, this is red blood vessel. Now, at a particular site, injury is there. At that injury site, all the platelets will come and will get activated. But this platelet plug forms only at this site of injury, not everywhere. Excuse me. The reason is, see, the adjacent endothelial cells will be releasing nitric oxide. That nitric oxide will inhibit platelet plug formation in all these areas. So platelet plug is restricted to only the site of injury. Look at them. See, the adjacent normal endothelial cells physiologically release nitric oxide, which is a platelet inhibitor. So this is the answer. Moving to the next one. Now, which statement is not true about grafts? First, understand about this graft. See, autograft, understand this one. Autograft. See, all these grafts means tissue exchanges, like tissue replacements. Now, autograft means auto means self. Now, this is usually done for cosmetic purposes. When someone's face skin is damaged, the same person thigh skin is replaced to give cosmetic look on the face. That is called as autograft. Auto means self. Now, second one, isograft. Isograft means, see, the tissue replacement between twins, especially monozygotic twins, they are genetically identical. So genetically identical people, when there is an exchange of tissue, that is called as isograft. Now the next one, allograft. See, allograft means between the same species, between two individuals, two humans. So this is what usually happens. So kidney transplantation, liver transplantation occurs between two humans. This is called as allograft. Now the last one, xenograft. Xeno means foreign. When an animal tissue is given to human beings between different species, it is called as xenograft. So recently a pig heart is transplanted in human being in USA. That is called as xenograft. Now understand, see, not true. Now let us see what all things. See, isograft, what did I say? Isograft is between identical twins or genetically identical people. Now isograft in which donor recipient is the same individual. No, it is called as autograft. Now next one, autografts are grafts between donor and recipients of same genotype. No, same genotype means isograft, same individual means autograft. So this is reversed. Now the next one, allografts are those in which donor of the same species between two human beings but of a different genotype. This is true. Now xenograft are those in which donor is of different species from that of recipient. This is true. So only C and D are true. Now, which statements are not true? The question is about not true. So A and B are not true. So A and B are not true. This is the option. Understand this concept. Auto means self, iso means identical, genetically identical people, allo means same species, xeno means different species. Last one. The formation and maintenance of myelin sheath around CNS axons are done by, understand this question. See, myelin sheath is formed by Schwann cells, but it is in peripheral nervous system, not in CNS. So this is not the right answer. Oligodendrocytes will form and maintain myelin sheath in CNS. So this is right. Now microglia acts as immune cells of nervous system, astrocytes will maintain the blood-brain barrier and energy metabolism in the CNS. So the right answer here is oligodendrocytes. So these are all the pharmacology related questions which are tested in GPAT 2022. If you like the video, do subscribe and share. Thank you for watching this video.